In the name of Allah, who is most merciful and most beneficent. I'm Dr. Ambreen and I am a physical therapist by profession. Today I am going to deliver you a lecture on anticoagulants. Anticoagulants is a topic that comes under the subject pharmacology and therapeutic work. What is anticoagulants? Basically, we have to understand about the coagulation so that we may move towards anticoagulants. Anticoagulants are the drugs to treat the excessive fluid formation that can be grouped into three main categories. All those drugs that prevent the excessive fluid formation are grouped into three categories. One of them is anticoagulant, the other one is thrombolytic that lyses the thrombus, and third one is antiplatelet drugs. So what we are going to start in this lecture is anticoagulants. General view of anticoagulant is drugs that prevent the clotting of the blood is called anticoagulants. What is coagulation? Coagulation is basically an instant process that occurs once a blood vessel has been ruptured. Like the blood begins to solidify to prevent the excessive blood loss. So whenever a small or even micro level trauma occurs at the level of the blood vessels, the blood begins to solidify and to prevent the excessive blood loss from the vessel and prevent further invasive substances from entering into the bloodstream. So whenever any like blood vessel is open, what happens? The blood will excessively loss, and further there would be somehow in entry of the invasive substances into the bloodstream. So Allah Subhanahu wa Taala has prevented us by like this normal process of coagulation. This coagulation actually like blocks the point at which there is leakage or where there is injury. Coagulation is a cascade of enzymatic reactions at the end of which soluble fibrogen is converted into insoluble fibrin. What happens in the natural process of coagulation that usually occurs in our body is basically somehow enzymatic reactions that you have studied in physiology. At the end of these chain of reaction, the insoluble fibrogen converts to a soluble fibrin, and fibrinogen basically a property of the plasma. You can say this coagulation is the property of the plasma where the fibrinogen that is formed by the liver, and every drop of the blood has fibrinogen, which is a protein which is soluble in the plasma is present. So what is actually this coagulation? It is a property of plasma that the plasma tends to accumulate, and in this plasma there is basically a soluble fibrinogen, and this soluble fibrinogen has actually been formed by the liver, and in every drop of the blood in our like blood there is fibrinogen. So whenever there is a process of these enzymatic reactions that are going to lead towards the coagulation, the soluble fibrinogen is converted to insoluble fibrin. And these fibrin threadworks are it is going to form a meshwork, and it is going to aggregate these fibrin threads. So what is a blood clot? You can see the white one are like fibrin meshwork, and the RBCs and platelets are going to like fulfill it. So a clot is basically consists of the platelets that are meshed into the fibrin threads. So a web-like accumulation of the strands with the RBCs. There are two major factors of these clotting facts of this clotting mechanism is the platelets and the thrombin system. The whole like process of coagulation is being controlled by different substances like the platelets, the thrombin system, the role of the fibrinogen into fibrin. They all going to like cause the normal process of coagulation. This is a whole chain, a cascade of enzymatic reactions. So whenever there is some micro trauma, blood intrinsic like injury, blood vessel injury that occurs usually in a blood vessel. So what happens is the factor 12 is going to convert activated form of 12, that is 12A. 12A stimulates like factor 11 that activates and get activated. Factor 11, the factor 11 then activates the factor 9 and becomes factor 9 activated. Factor 9 is responsible to stimulate factor 10, and it is going to like stimulate the factor 10, and 10 is the final one, or it is even going to convert the prothrombin into thrombin, and this thrombin is now responsible to convert the soluble fibrogen into the insoluble fibrin monomers, and these fibrin monomers are going to combine and form a fibrin polymer. There is another like extrinsic pathway whenever any external injury occurs and it leads towards the blood loss. The Allah Ta'ala has made our system in such a way that it strives to coagulate the blood at the point where there is a leakage, and it like normalize it and at least towards a normal structure. so prevent excessive blood loss inside this way, and even prevents the invasive materials to come inside the circulation. So this is normal if it happens in the normal range, but in case if it leads to some abnormality and it begins to start coagulation while the blood is continuously moving, so it's like something that is like point to be consideration. So we are going to use anticoagulants. So we will discuss the points why abnormal clotting is going to occur. Coagulation is the blood is going to clot. Anticoagulants are those that inhibits the clotting of these like all the substances. So what happens when abnormal clotting starts? This is the point. These anticoagulants basically are heparin. Heparin is one of the commonly used anticoagulant. The group of orally acting agents like warfarin and other orally being used anticoagulant. Other coumarin derivatives are also anticoagulants. So we'll discuss about these anticoagulants, and the point is why there is a need to use these anticoagulants. So these drugs are primarily a treatment of choice in case of abnormal clot formation in the venous system. Normally, what happens? This is just a picture to show you. This is a normal blood vessel. These are the red like RBCs and the blood circulation. And what happens? Normally, there are thousands of the point there where there is a microvascular injuries, and normally what happens is that these cascade of enzymes like starts, and they normally leads towards the coagulation, this clotting, and the blood is going to leak from here. What happens is the normal coagulating system activates and it tries to fulfill this by forming a clot. But if this clot, if basically for a beneficial need, but if this clotting mechanism continues and it begins to like accumulate these substances inside, in this way it is going to hinder, and this is going to cause a thrombus, and this thrombus if continuously leads towards the abnormal clot formation, it will ultimately become larger and larger, and this will like cause a problem. So sometimes if this thrombus dislodge, if this clot become detached from this vessel, and it will cause up emboli, and emboli begin to move toward with along the bloodstream, and it will cause a may dislodge anywhere in the brain vessels or anywhere in the heart, and may lead towards the stroke and heart attack, myocardial infarction. So this is the point. This is very dangerous. So we must need to prevent these clotting formation and this abnormal clotting formation. The next is venous clots typically form in the deep veins of the lungs. This also says that this is one of the reasons the abnormal clotting is going to occur. Another reason is whenever there is a sluggish blood flow, the blood flow is very poor. What happens in such a case is the venous clots typically form in the deep veins of the legs because of the relatively sluggish blood flow through those vessels. The DVT, that is deep venous thrombosis, is the primary indication for the anticoagulant therapy. So those persons who have relatively sedentary lifestyle, they have a sluggish blood flow. So what happens, especially in the patient with stroke, the paralysis, the patient in the present in the ICU, what happens is they have a relatively sluggish blood flow, and the elderly patient also who does not do activities, they have a sluggish blood flow. And usually, if they remain in the on the bed, what happens is gradually what the blood begins to solidify, and venous clots begin to form. So this is called DVT, and in DVT, anticoagulants are the drug of choice. DVT usually results in, if the DVT continues, then it may cause certain problems like the piece of the clot breaks off, it may travel towards the circulation, load somewhere else in the vascular system, in the brain, in the heart, in the kidney, and anywhere else. So this is a point of consideration that we must ponder it. Ambuli that originate in the venous system typically flow the venous flow back to the right side of the heart, where they are then pumped to the lungs. They finally lodge in the smaller vessels within the lungs, thus creates a pulmonary embolism. Uses of anticoagulants. So where the anticoagulants are being used, anticoagulants are those drugs that prevents or inhibits the clot formation, abnormal clot formation. They prevent the abnormal coagulation of the cells. Fine. So we are going to use them in acute treatment of the venous thrombosis and thromboembolism. We can use prophylactically to those individuals who are at a high risk to develop venous thrombus. The point is who are at a high risk to develop the venous thrombus. I earlier told you those patients which have a relatively sluggish blood flow, mean those patients which have a sedentary lifestyle, those who are present in the ICU, that are on the bed due to the fractures, strokes, and all those problems, or elderly patient. So we are like thinking they might develop DVT, deep venous thrombosis, as their muscles are not going to pump the blood as the normal circulation. So in such a case, the DVT has a more like chance to develop. So prophylactically mean for preventive measures and for like pre-planned measures, we are going to use anticoagulants. The next is often surgical procedure after the joint replacement therapy. The patient has to take rest and like if they are somehow immobile, their level of mobility has been reduced. In such a case, it's a preferable one. Mechanical heart valve replacements in case of heart valve replacement, we prefer to use them. Certain cardiovascular incidents like myocardial infarction, ischemic stroke, we try to prevent the reoccurrence, so we use anticoagulants so that the blood does not again coagulate. Sorry. During the medical conditions, and the patient will have a relatively inactive for the extended periods of the time. The extended periods of the time in the like after you can any fracture, any injury, or somehow stroke, ICU patients like they are more prone to lie on the bed, especially the elderly ones. Now we're going to discuss about the classification of the anticoagulants. Mean the point what are the drugs that can be possibly used. There are two sort of categories: fast acting and slow acting. Fast acting is heparin or like heparin type drugs like heparin IS, heparin sulfate and dextran sulfate. Low molecular weight heparin, dalteparin, tinzaparin, nadriparin, and ribavirin. Normally, heparin is present in the blood. Heparin is present in me. What the heparin is going to do, heparin is going to prevent the clot from like clot formation, abnormal clot formation. So what is the if there is a deficiency of heparin and the clots begin to like form, and we use like exogenous heparin to like fulfill the demands. So the role of heparin is very important. Soon we are going to discuss how heparin help us. This is very important. Synthetic heparin derivatives are also present, fondaparinux. Direct thrombin inhibitor is the one that can inhibit the thrombin after it has been even like stimulated by all those cascade of like enzymes. So if we inhibit the thrombin, it will not work. It will not convert the soluble fibrinogen into the insoluble fibrin. Ergotamine is a commonly used drug thrombin inhibitor. The next is slowly acting anticoagulants, or the one is warfarin, oral anticoagulants, coumarin derivatives, bis hydroxycoumarin, warfarin, sodium nicoramolone. They are commonly being used as an oral anticoagulant. So heparin always being used intravenously. This is an important thing you must know. And the warfarin always preferably used as a like warfarin oral anticoagulant. And then dione derivatives, phenandione, diphenandione, they are also the members of this class. The next is what is the prime effect due to which it is being indicated. It's again same thing. Why we are using the anticoagulants? We actually want to inhibit the synthesis, the function of the clotting factors. Those clotting factors that are actually stimulating one another, and they are going to ultimately cause the activation of the thrombin and fibrinogen to fibrin. So we want to inhibit the synthesis, the function of those clotting factors, as we want to prevent the anticoagulation. Secondly, they are used primarily to prevent a treat. If and second point is if the venous thrombus or emboli has been formed, we don't want to like make it bigger. So we want to resolve it, we want to lyse it, or we want to like eliminate it. So we primarily prefer to for the prevention and treatment of venous thromboembolism. Primary drugs used in the initial treatment of the venous thrombosis, the anticoagulant effects of heparin are seen almost instantly after the administration. Heparin is very active, it is being used intravenously, its efficacy is very like high, so we preferably use it. Heparin is discovered by Maclean in 1960. It is actually found in the mast cells of the liver, lungs, intestine, and mucosa. It is one of the strongest acid in our body. Now, the important thing about heparin is the mechanism of action. So we will clearly like discuss it. Heparin. So mechanism of action of heparin. Heparin works by potentiating the activity of a circulating protein known as antithrombin 3. What happens is our blood, my blood, and your blood obviously have antithrombin 3. But we have a deficiency of heparin, so we are actually using this heparin. So what actually the heparin do is heparin. This is heparin. Just like it has this heparin. Heparin always like stimulate, you activate this antithrombin 3, and this antithrombin 3 is always present in the blood, so it is circulating. But whenever there is a need to prevent the coagulation, the heparin get activates, it attached antithrombin 3 attached to it. After binding to antithrombin 3, when these has binded, it will inhibit the formation or activation of several clotting factors, thrombin, and renders these clotting factors inhibit. So this antithrombin 3 inhibit the activating factors, clotting factors. Heparin also accelerates the antithrombin 3, induce inactivation of thrombin and clotting factors like the factor 10A, like the factor 9A, thus reducing the tendency of clotting and thrombogenesis. Thrombogenesis means formation of thrombus, and tendency, it also reduces the tendency of the clotting factors to promote the coagulation. We have pictures to clear this mechanism of action. You can see in this picture I just drawn for you. This is the heparin molecule that is present in the endothelial layer of the blood vessels. And this one is antithrombin 3. The antithrombin 3 is going to attach this heparin and it get activated. When it get activated, what it do is it inhibits the thrombin, fine. It inhibits the factor 10A. It inhibits the factor 9A. So by inhibition of these clotting factors and thrombin, it is going to prevent the coagulation. I'm again going to revise it. Heparin is going to attach to a circulating protein that is present in our blood, that is antithrombin 3. So heparin, when attached to the antithrombin 3, it activates it. So when antithrombin 3 get activated, it inhibits the two clotting factors, the thrombin, clotting factor 10A, 9A, and thrombin molecule. So in this way, it inhibits the synthesis of the thrombus or abnormal clot formation. You see another picture to show you. This blue one is heparin. This light blue one is antithrombin 3. So what happens is when heparin and thrombin get attached to each other, they inhibit the main thrombin, especially, and clotting factors as well. So these are the pictures to clear to the mechanism of action of the heparin. The next is pharmacokinetics. Pharmacokinetics means what this is all about the drug and what a body is going to do with the drugs. Heparin by nature is a large sugar-like molecule, so it is poorly absorbed from the gastrointestinal tract. So it is always preferably administered parentally, intravenously, or sometime by intravenous injections. Adverse effects. Bleeding is very, very, very common adverse effect of this heparin and anticoagulant. Just you remember, it's not like nausea, vomiting, diarrhea. You always write down that say adverse effect. This is a different adverse effect. Just think they are anticoagulants. They prevent the coagulation. So they are going to prevent the coagulation all the time. So if a patient is taking these drugs for prolonged duration of action, what happens is their blood is always in the form of coagulation state. So the most common adverse effect is bleeding, because the process, whenever there is an injury, blood has no tendency to do clots formation, so it leads towards the bleeding. Hypersensitive reaction like skin rashes may occur. Thrombocytopenia is decreased, like platelet count in the body. Alopecia is baldness, osteoporosis. These are the different side effects of these anticoagulants. The next is the low molecular weight heparins. They offer certain advantages, like they can be administered by subcutaneous injection into the fat. So they decrease the need for repeated intravenous administration, while the heparin is always taken through intravenous route. Like here in this case, heparin is not being used for intravenously. They are low molecular weight, so you can even use them subcutaneously. So they are even more convenient to use. The person can administer easily, while the intravenous one, they need a doctor and specialized expert who know the anatomy of the body. They offers an easier and more convenient route, especially for the people who are being treated at home and or as outpatients. It also have a long duration of action, less risk of adverse effect as compared to standard heparin preparations. The next is direct thrombin inhibitors. Like agatrombin have a very rapid onset of action, predictable absorption. So it is also preferably being used. The next is synthetic heparin that has been synthetically derived. That is fondaparinix. They are also given injections once daily. They have a duration of action, long duration of action. Fondaparinix is licensed for initial treatment of the venous thrombosis, pulmonary embolism, and embolism in the lungs, venous thromboembolism, prevention in the patient undergoing the surgery for hip fracture or even hip and knee replacements. Now there is a heparin antagonist. This is not anticoagulant. This is the heparin antagonist, protamine sulfate. It is always also given intravenously. It neutralizes the heparin as in case of heparin overdosage. Sometimes I like by mistake or by suicidal point of view, I have taken high dose of heparin. So my heparin is actually leading, going to cause anticoagulation, and my blood is going to like if I have a cut or it may lead towards the bleeding and it may promote the bleeding. So there are such emergency cases where there is an overdosage of heparin. We give an antidote that is heparin antagonist. That would be heparin antagonist. Its name is protamine sulfate. Protamine sulfate is very important as you have to memorize it as it is the only one heparin antagonist being used in overdosage. Fine. Next is another class of anticoagulants. So previously we have studied about all about heparin. Now we're going to study all about the warfarin. Warfarin is an oral anticoagulant. The important thing about warfarin is we use it orally. Heparin we use intravenously. Oral medication, synthetic derivative of coumarin, a chemical found naturally in many plants. They decreases the blood coagulation by interfering with the vitamin K metabolism. This is another important thing about warfarin is warfarin actually perform its mechanism of action by preventing the synthesis of few clotting factors. Like few of the clotting factors are made up of vitamin K, and vitamin K is a major component of this, okay, you can say the chemistry. So if we inhibit the vitamin K synthesis, these clotting factors that are made of vitamin are going to be inhibited. So they stops the bleeding from the clotting within the blood vessel. They are used to stop existing clots for getting bigger, as in DVT, or to stop the parts of the clots breaking off and forming emboli. And they prevent the thromboembolism. They prevent the thrombus to become embolism. The most common side effect of warfarin are bleeding and bruising. The bleeding can be in form of prolonged, like bleeding from cuts, bleeding that does not stop by itself, as the natural synthesis of the vitamin K has been like stopped. So vitamin K is not present. Clotting factors like factor 2, 3, 7, 9, and 10 are not present. 2, 3, 7, 9, 10. The even protein C, S, and Z are not present. So they are going to inhibit the normal process or cascade of enzymatic reaction of clotting factors. If any one of the factors among these chain is missing, it is not going to activate the next step. And in this way, they are not going to proceed towards the normal coagulation. I'm again going to revise the mechanism of action of warfarin. Warfarin inhibits the effective synthesis or the biological active forms of the vitamin K dependent clotting factors. They inhibit the clotting formation just by inhibiting those vitamin K dependent clotting factors like 2, 3, 7, 9, 10. Factor C, S, and protein Z. As onset of action is slow as it is being used orally. Second point is it is slow in on action. Like it takes 1 to 3 days, because the oral anticoagulants don't destroy the already circulating clotting factors. The orally present anticoagulant, the warfarin that I eat, is now going to stop the synthesis of vitamin K, but it is not responsible to prevent or destroy the previously present clotting factors. Fine. Prothrombin time is measured to monitor the treatment time. It takes 5 to 7 days to return to normal after stopping the oral coagulant. If I'm going to take warfarin and now I'm feeling okay, but after leaving or after stopping the use of oral anticoagulant, what is going to happen is I'll take 5 to 7 days to start my coagulation process, because vitamin K synthesis has been stopped when I was taking warfarin. So now when I stop taking warfarin, it takes 5 to 7 days to synthesize the vitamin K and to synthesize the clotting factors. So it needs complete or absorbed orally and 99% bound to plasma affinity. The another very important thing about warfarin is we have studied in the first chapter that warfarin has 99% binding capability with plasma proteins. Warfarin has tendency to bind to the plasma protein by 99%. 1% form of the warfarin is free for action, for metabolism, and for excretion. So when this free form is being utilized, then the 1% of the 99% is going to again come in the free form. It is going to be utilized. So being it has the tendency to bind to the plasma protein. It has a long duration of action. Fine. Warfarin is orally being used. Important. It has a slow onset of action, like 1 to 3 days. Fine. Is like inhibit the synthesis of vitamin K dependent clotting factors. Another important thing is it's completely absorbed orally. Fine. It has good absorption. But another point about this is 99% warfarin bound to the plasma protein. The next is warfarin adverse effects. The major and common adverse effect of warfarin is again hemorrhage. The main adverse effect bleeding in the intestine, brain, nose, and gums. Allergic reaction like skin rashes, GIT disturbance, and like nausea, vomiting, diarrhea. Teratogenicity is also common. So, what should the treatment while in case of so many adverse effects? Stop the use of anticoagulants. Second most another thing about this is fresh blood transfusion is given. As we earlier said, if we suddenly stop use of anticoagulant, it is not going to cause the coagulation and going to help us if I stop taking warfarin. For example, I was taking warfarin, fine, but now I'm feeling fine. Or like here in the case, I have adverse effect. If I stop taking the warfarin, the effect of coagulation does not start immediately. It takes 5 to 7 days. For now, if I have overdosage or I have so many adverse effects, so doctor or I want to stop the anticoagulants to prevent the bleeding or hemorrhages that is going to occur, and due to which this anticoagulant intake, the blood vessels have no tendency to form platelet plugs and refill the micro injuries and all those things. So I'm going to stop these anticoagulants. So what is going to happen is by stopping the anticoagulants immediately, it does not have a tendency to again start the clotting enzymatic reactions. So in such a case, the preferable thing is fresh blood transfusion is given to supply the clotting factors. Like another vitamin K1 oxide, because the fresh blood transfusion contains already clotting factors, we are going to take ready-made clotting factors in the blood. So these clotting factor is going to help us and going to make plugs wherever there is required. Antidote, another antidote is vitamin K1 oxide. It allows the synthesis of the clotting factor. You are going to stop anticoagulants, but the important thing is you are going to induce fresh blood transfer. You are going to give them, you are going to make them already ready to make, ready to perform clotting factors in the blood. They are going to immediately going to act. Another thing you can do is you can give them vitamin K1 so that the vitamin K1 help it and synthesize the clotting factors. But obviously, it takes several hours. So, in emergency, fresh whole blood is necessary to counter all these adverse effects of oral warfarin side effects: severe bleeding, bleeding from the rectum or the black stool, skin conditions like rash or itching or fever, swelling of the face and throat and mouth and bruising. All these effects are related to bleeding. And other are nausea, vomiting, diarrhea, fever, muscle ache, and difficulty in moving, numbness, weakness, and painful situation in such a case. The important thing is hemorrhages, bleeding, and the important another thing is bruises are going to form simple side effects and nausea, vomiting. Contraindication. Contraindication of anticoagulants. The major contraindication is bleeding. We are not going to use these anticoagulants in the person who already have bleeding disorders. Severe hypertension. We are not going to use anticoagulants in the patient with severe hypertension. Malignancies, bacterial endocarditis, liver, kidney diseases, intracranial hemorrhages, ulcers present in the GIT, gastrointestinal tract. The ulcers are already present. We are not going to use them. The next is fibrinolysis. This is another thing. So before going to start fibrinolysis, I just want to revise about anticoagulants. Anticoagulants are the drugs that has been categorized into two classes: fast-acting, slow-acting. Fast-acting includes heparin, heparinoids, and synthetic heparinoids like this. Or slow-acting includes mainly warfarin. Heparin is being used intravenously, first thing. Fine. It's a large molecular weight, so its absorption is poor. What it is going to do is heparin is going to attach to circulating protein antithrombin 3. And what it is going to cause? It is going to cause the activation of antithrombin 3. And the activation of antithrombin 3 inhibits the thrombin and clotting factors. So this way, it is going to inhibit the clot synthesis. The major adverse effect was bleeding. The others are thrombocytomenia, alopecia, osteoporosis, like the and hypersensitivity reaction. Then we studied about warfarin. Warfarin is always given orally. It is being used. It has a slow onset of action. It is going to inhibit the synthesis of vitamin K dependent clotting factors. And the next is it has severe adverse effects like bleeding and hemorrhages. Antidote in case of emergency or in case of dosage, we must stop the anticoagulants. The main thing we can do at that time is the introduction of the fresh whole blood because the fresh whole blood contains the clotting factors. The next, we can also give them vitamin K1 oxide to synthesize the clotting factors. The next is topic we are going to start is fibrinolysis. As the name is indicated, fibrinolysis. The fibrin polymer means the accumulation of these fibrin threads that has formed a clot. We want to lyse it. They are also called thrombolytics or fibrinolytics. So you can see in this picture, this is a tissue plasminogen activator that is going to activate the plasminogen, and plasminogen when activated by the circulating tissue plasminogen, it converts into plasmin, and plasmin has a tendency to degrade the fibrin monomer polymers, fibrin threshold. So thrombolytics are the drugs that lyse or dissolve the clot or thrombi by activating the natural fibrinolytic system. Thrombolytic drugs are streptokinase, altiplase, reticlase, synactiplase, dutyplase. Streptokinase, altiplase, reticlase, synactiplase, and dutyplase. Streptokinase is a bacterial protein that is produced by the group of the beta hemolytic streptococci. Its mechanism is it binds to the plasminogen, producing an activator complex that lies free plasminogen to proteolytic enzyme plasmin, and the plasmin has a tendency to degrade the fibrin clots as well as the fibrinogen and other plasma protein. Urokinase is an enzyme produced by the kidney and is found in the urine, so it is more expensive than streptokinase because its derivation is more like expensive. Urokinase acts on the endogenous fibrinolytic system by converting the plasminogen to plasmin, and the plasmin degrades the fibrin clots as well as the fibrinogen, some other plasma proteins or non-fibrin selective. Reactivase is another human tissue plasminogen prepared by the recombinant mutation technology. It's a fibrin specific. It has a long duration than altiplase. Tenactiplase is another genetically modified human tissue plasminogen activator prepared by the recombination technology. It's more fibrin specific and longer duration than the altiplase. And defense effects are bleeding, hypertension, and fever. So therapeutic uses in the conditions in which we preferably use his anticoagulant. We preferably use them in acute myocardial infarction, in acute ischemic stroke, pulmonary embolism, DVT, arterial thrombosis, and embolies. The last one are the contraindication of these thrombolytic therapy, meaning the condition in which they are contraindicated. They are contraindicated in the patient who have a recent head trauma and cranial trauma. In the patient who already have a trauma who does not want to promote the bleeding. Previous hemorrhagic shock, we don't use these thrombolytic as well. Stroke or cerebrovascular event that occur in 1 year old. Active internal bleeding, major surgery that happened within 2 weeks because already the coagulation is going to undergo. We don't want to inhibit the plug formation. Active peptic ulcers, where those who are already bleeding, we does not preferably use these anticoagulants and thrombolytics. Just we don't want to exaggerate the process of peptic ulceration. Diabetic retinopathy, pregnancy, uncontrolled hypertension. So what can we do in case of the overdosage of these fibrinolytic drugs? Epsilon aminocaprylic acid and tranexamic acid are the drugs that are said to be fibrinolytic inhibitors. The drugs that inhibits the fibrinolytic process that has exaggerated. So they inhibit the fibrinolysis by the competitive inhibition of the plasminogen activation. Tranexamic acid can be given orally, topically, or intravenously. They are preferably used, especially in the overdosage of fibrinolytics, mean where you has taken already overdosage of altiplase, streptokinase, that lactase, postpartum hemorrhage, where we want to now use fibrinolytics and prevent the bleeding. These are basically indirectly it's a coagulant. Fine. After cardiac surgery, bleeding or peptic ulcers, following the dental procedure when there is a enhanced bleeding, who you preferably use fibrinolytics to inhibit the stop the actually bleeding. Menorrhagias are painful menstrual cycles. Epistaxis is the bleeding from the nose that usually occur in summers due to like high temperature. Bleeding from the vasodilation actually occurs, so it leads towards the bleeding from the nose. Bleeding from the eye injury is, in such a case, we also preferably use is fibrinolytic tranexamic acid. Thank you so much, class. This was all about the anticoagulants, all about the heparin, and the next was warfarin and thrombolytic drugs. Inshallah, see you in the next lecture. Till then, Allah.